Cleft and palate are very common congenital defects that are not just physical but also cause a lot of mental and emotional trauma. Some experts say that the highest cleft incidences are 1 in 700. Hello everyone and welcome to the Navin Times Talk from the Heart. Smile Train is an international children's charity that has been doing commendable and sustainable work in this area. Both our guests today are from Smile Train. We have with us Mamta Carroll. She is the Senior Vice President and Regional Director Asia of Smile Train, and Dr. Krishnamurthy, a maxillofacial surgeon who is currently working as a consultant as well as a project manager for Smile Train in Bangalore. Hello Mamta, hello Doctor, welcome to our show.
Hello Maria, thank you.
It is a pleasure to be speaking with you because cleft and palate is not an area that is very often spoken about. So we know that we have a lot to learn from both of you. The first question to you is, Mamta, tell us about Smile Train. I have said that it is an international charity, children's charity. So can you tell us what exactly is the work you all are doing and what is the vision behind your organization?
Right, so thank you Maria first of all for inviting us and giving us this opportunity to talk about clefts. A Smile Train actually started its operations in India in the year 2000, and since then we have supported more than 675,000 surgeries, lakh surgeries in India alone. India
Wow.
by far is Smile Train's largest program run, and we have tie-ups with more than 150 hospitals all over the 29 states and union territories and in about 110 cities. See, the basic premise of how Smile Train is founded is that we work with only local doctors. So we follow the teach a man to fish model, which basically means that Smile Train empowers local doctors and hospitals with funding, training, and resources to provide the 100% free cleft surgery, and not just cleft surgery, it's a comprehensive cleft care treatment such as nutrition, counseling, speech therapy, orthodontics, everything to do with the cleft treatment, absolutely free for the cleft child and the family and all the communities. So basically working with the local doctors, working with the local communities to provide this treatment. You know, unlike other charities or other organizations you may have heard who are mission models, Smile Train works only with our own people, just empowering them with whatever I just kind of spelled out to carry on this treatment for the children. And this is how we work. And the other thing is remarkable about the organization is that we are only focused on this one anomaly, on this one birth difference, which is cleft. So you can say that we are a one-stop shop for clefts. So right from the surgical treatment to the comprehensive care, everything is supported and covered by Smile Train. And this is this unique model of Smile Train, where it's the world's largest organization focused only on clefts, where we work in more than 90 countries in the world with about 1.5 million cleft surgeries that we have supported since the time we started. And this is only because of Smile Train's unique operating model.
Those are amazing, absolutely amazing and very commendable numbers. Helping children, especially with something, a condition like this is great work. Now, you have said that you are spread all over in 90 countries. Tell me, in India, what is the prevalence of this condition?
Right. So in India, again, the prevalence is what you have, the global prevalence, what you said in your introduction, is 1 in 700. but because of our sheer population and the numbers, about 35,000 children are born with this birth difference every year in our country.
Right. And what about the global numbers? Do you have any numbers to share with us?
Yeah, the global numbers are basically averaging between, let's say, again depends on the population of a region or a country, but the prevalence and the incidence, as I said, is 1 in 700. And, it depends on how populated the country is. And the more populated it is, obviously the more children are being born with clefts. And therefore, as I said earlier, that, Smile Train, since we started in India, we've already supported more than 6,75,000 surgeries already. And globally, it's like 1.5 million, depending on, the Africa region or the other regions would, depending on the population of their countries, would basically, differ from India, India being the largest.
Right. So let me get this right. You're saying there are about approximately 35,000 children in India that are born with this condition in a year.
Absolutely.
Right. Doctor, let's go to you. I have said that in my introduction that it is a congenital problem. What exactly happens and why does it occur?
Yeah, so we know some of it, we don't know all of it, but the fundamental issue is that when a baby is growing inside the mother's womb, the first 12 weeks are very important, which we call the first trimester. And in this period, all the organs and systems are formed. Now, there are a number of steps, complicated and complex, intermingling with others, one after the other sequentially, that in this 12 weeks gives rise to a small baby or a fetus within the uterus. Now, any mistake in these signals that are being received, which starts around 6 or 8 weeks of life, can give rise to a birth defect or a congenital anomaly. So what tends to happen, what has been found out, is that there are various genes which provide these signals at the right time are defective in children who are born with cleft lip and palate. A whole lot of genes have been isolated. There are certain diseases which are a single gene malfunction disease. Classic example is, you might have heard of something called as a sickle cell anemia. It's just one gene that is defective, but here dozens of genes have already been identified in different subsets of cleft patients. But what we know is that these genes, when they do not provide the right signal, there is a disorder or a disruption in the development of the fetus. What causes this genetic abnormality, we call it a mutation, is again very complex. It can occur as a result of various factors that we may be exposed to or our parents may be exposed to, what we call as the environmental factors. The classical ones that have been identified so far include certain drugs. For example, if the pregnant mother is having seizures or fits and she's on a drug called phenytoin during that first few weeks of pregnancy, this drug can induce a genetic mutation or a change and thereby cause a cleft lip. There are certain infections that are known to cause other congenital defects, like for example in the heart, which may also cause these problems. Classical among them is what is known as the German measles or mumps. And if the pregnant mother was not vaccinated against this vaccination happens when you're a child, 12 to 18 months of age, and if that has been missed and she gets an infection of this German measles or rubella, then you could get the baby is in danger. Various other factors have also been implicated, like smoking, like significant consumption of alcohol, being exposed to the smoke when you cook with firewood, etc. These are all not fully substantiated, but the work goes on. Sometimes these mutations are called spontaneous, which really means we don't know the reason for that. And this spontaneous mutation could occur in the generation of the parents, which means it's not carried on from previous generation. So in about 25 to 30% of children with cleft lip, we get the history of this being in the previous generations too. In other words, it's hereditary, but in the rest of them, we don't get this history because these mutations might have occurred at the, in the genes of this baby's mother or father.
Okay. Okay. So there is no particular reason for it. There are many reasons, but it cannot be pinpointed as to what exactly causes. Am I right?
That's right. In our jargon, we call it multifactorial. You're right.
Right. So it is multifactorial. Now, doctor, I know where if I hurt myself by chance, bang my lip against something, it hurts, it cuts on my teeth, and I get a cut. For that day or for the next 2 days, it becomes very difficult to eat or to drink. So children with this condition, they must be going through a lot of discomfort. What exactly happens when this, what are the effects of this condition on children?
Yeah, so let's start from the time the baby is born. That's when we encounter the first problem. And this is the issue, particularly if there is a cleft inside the mouth called the cleft palate. This problem of feeding, which I'm going to start off with, doesn't usually happen if it's just the cleft on the lip itself. Now, the first problem that is encountered by the baby is baby can't suckle mother's breast. Breastfeeding today is universally considered as the best mode of feeding a child for the first 6 months. And this precious, once in a lifetime opportunity is denied to the baby when it's born because of this cleft. She's not able to suckle mother's breast milk. So not only do we have a problem here, it can get compounded if the mother is ignorant or is not educated about the alternative methods of how to feed the baby. So this is what Mamta referred to as nutritional support. So it might just be educating the mother as to how the baby can be fed. Now, the alternative, the next best alternative is to express the breast milk, because if you can't do breastfeeding, the next best is breast milk feeding, which means the baby can't do it herself, so we express it out. It can be done manually. Today, breast pumps are available to make it much more easier, more efficient, easier. So this can be used, and when or if this falls short, we can add on other milk supplements. So feeding is the first problem the baby encounters, and if the baby cannot be fed well, there's a whole chain reaction that sets in. Baby can't grow well. Failure to thrive then can predispose the child to significant and life-threatening infections very early in life, and it can be a very sorry casket. Now, once this thing is taken care of, obviously there is the issue of the appearance of the baby. This is not a problem for the baby, it's a problem for the parents, because here is a situation where they're expecting a joyous arrival of a bundle of joy, and then, to their utter shock and dismay, all is not right. And sometimes this can be a significant shock to the parents. Nowadays, we can pick this up even while the mother's pregnant by what are known as ultrasound examination. So while she's pregnant in the 2nd trimester or in the 4th month, they do an ultrasound scan to see if the organs are properly formed or not. And if this was done, and if this has been picked up, which is not always the case, we can then prepare the parents for this arrival and kind of absorb or soften the shock that they will experience when this baby is born. So this is another very significant aspect of the problem, where the parents need to understand, yes, there has been a problem, but all is not lost, that in course of time, this child can become a normal, healthy citizen, belonging as much as anybody else.
Right. Doctor, I would like to ask you a question. You said that in the second trimester, if an ultrasound is done, this problem can be detected, right?
That's
So
correct.
this is in all cases. Every ultrasound can show you this, or are there special ultrasounds that need to be done to identify if there is a problem?
Every ultrasound can show it. These days they're getting more sophisticated.
Right.
We have what are known as 4D ultrasounds.
Absolutely.
But often it is also dependent on other circumstances. It's not just the technology. Because particularly if you have only cleft of the palate, which means the lip is normal, the defect is only inside the mouth, it can be missed often. So it's not that the sensitivity is not 100%. It picks it up in less than 100%, and the pickup rates vary from center to center. So it's not that always they are picked up, but when there is a cleft of the lip and the palate, it is much more frequently that it is picked up.
It is detected. Okay. All right.
Yeah.
Mamta, coming to you, doctor has just spoken about the physical obstacles and the problems that these children face. Now, besides the physical problems, what are the other problems? And I am sure there must be a lot of superstitions also around this condition. Can you share something about that?
Yeah, sure. So Dr. Krishnamurthy spelled out the physical challenges, and I think equally important, if not more, are the psychosocial, the psychological, the emotional distress that, not just the child, because, the child is too young to realize what is happening, but the mother,
parents,
the family, and the community, the neighborhood, and, in our country, it's just not one family that we talk about and we live in. We are talking about the entire neighborhoods. We are talking about community. We are talking about villages. So imagine what people go through when a child with a cleft is born. So there is obviously, because of lack of awareness, which is the main challenge, is that people, the mothers and the family don't know how to deal with it, right? And then comes, the various things. Because of lack of awareness, they do not understand that it's a medical anomaly, it's a challenge which can be addressed. There are treatments, Smile Train has all these 150 centers in 110 cities, and everything is free. So that is one side of the problem, where there is lack of awareness, so people don't know what this anomaly is, therefore leading to extreme emotional distress, where they feel, oh my God, this is my bad karma that, that has brought this child into our family, and perhaps we have to live with it because, this is the way God created, so I may as well live like this. So we've heard horrific stories of
I'm sure.
people coming and telling us that, this is, some God's avatar and we have to live with it, or, it's the mother has done something wrong in probably this lifetime or a previous lifetime to actually give birth to a child like that. And sometimes there's also like a superstition that in an eclipse, if you hold a sharp object, if you work with a knife or something, and then when you're pregnant, then you're not supposed to do that. So once you do that, it affects the unborn child, and the baby is born with a cleft. And then
Mamta?
they say, kata mot or kata talu.
Right. Mamta, I think this superstition is very prevalent even today, and it is not just in the rural areas. I know of someone who had said to me about a few years ago. I remember she said, I cannot come out for the next. A pregnant woman said to me that I cannot come out for the next few days because before, during, and even after the eclipse, I'm not supposed to. My mother-in-law, my mom have all told me that the eclipse, the grahan is bad, and my child will get that cleft or palate problem. Now, it's so nice that you have spoken about it. It's so good because now we understand that it has got nothing to do with that. Am I right?
Absolutely, it has definitely nothing to do with it, and therefore it becomes, a challenge for organizations like Smile Train, because we work with so many partner hospitals to first also concentrate on counseling, on education, on awareness. So our teams are going out, and we are doing these campaigns on awareness, and we are doing, tying up with organizations like the National Health Mission, or we are also tying up with FOGSI, which is the Federation of Obstetrics and Gynecological Society of India, to educate young mothers, to educate pregnant women and other, general public, because people are stuck in that, in that myth, in that superstition, and therefore, leading to a lot of delays in treatment, and leading to a lot of difficulties where, we are not able to give that timely intervention to that child. So it basically restricts everything. So yeah, awareness is a big problem, and there are certain psychosocial elements which are also associated with this anatomy.
Right. Now, we have spoken about that 1 in every 700 births, there is this problem that occurs. Does this occur in any particular socio-economic group, or is it just general?
See, it is general because, as I said, that 1 in 700, and cleft doesn't. Dr. Krishnamurthy spoke in detail, and gave us some technical details on the probable causes of clefts. But it is prevalent everywhere. The only difference is that people who have the wherewithal, people who are privileged, they have the money, they have the education, they have the awareness, they will obviously get their child treated at a very early stage, at a very early, young stage. And you and I will not get to see those children. Delayed treatment, we won't get to see the backlog, we won't get to see people roaming around here and there, because they would have already done that. Now, here comes the people who are not educated, people who are poor, people who don't have the wherewithal, they don't have the awareness to deal with it, and therefore we see that there are huge backlogs, or there is a huge number of clefts which are untreated, not because of anything else, but because they did not have the means to get to a treatment center which has free cleft treatment, or they were not really aware of it. So therefore, we see that in the underprivileged communities much more than you would see in the urban population.
So, Doctor, she has told us about the psychological problems that occur due to this condition. Now, if I bring, I haven't heard about the surgery. I am a woman from a rural area. I bring my child to you who is about 13 or 14. Is it too late, or can the surgery be done at any given time?
Yeah, that's a very good question you asked. Before Smile Train came into India and started this philosophy of local empowerment, there were thousands of children who grew up without treatment. So in the first few years of our work with Smile Train, we treated a majority of our patients used to be of the older age group. So we have a lot of experience in treating older untreated children, and the answer to the question whether it is too late, it's never too late. We've even done cleft lip surgeries to a grandmom. But
oh, really?
Yeah.
That's very heartening. That's very heartening, doctor, that there is no age limit and it can be done.
Yeah. But having said that, in terms of developing normal speech, this is something which we also need to remember, that if you have a cleft of the palate, the child is not going to speak normally if the operation is not done early on. So from the perspective of developing a normal speech, we need to do the cleft palate surgery early, around 9 to 12 months of age. So when we treat them as teenagers or older, there is always the possibility that we don't get the function back to the extent that we would have
required.
We would have liked to. Yeah, but it's not too late. There are strategies that we employ in the older children and adults. But thankfully, 2 decades plus of Smile Train has made these numbers extremely rare.
Right. Now, you said speech, that when you have this condition, speech is an area that is affected. Besides speech, and you said the baby cannot suckle when they are born, does eating also cause a problem later on as a child grows?
If it is not repaired, they learn mechanisms to swallow their food. So eating is not usually a problem in the older children if it's not operated. But in the newborn, it can be an issue because it starts coming out of the nose when you try to eat or drink anything. And eventually they learn to do swallow. So it is not usually a major problem, but it is defect.
Right. So when it is the lip, we see it is very prominent. You can see it that the lip, goes up. It's sort of disfigured. Where the palate is concerned, what exactly happens there, doctor? Because it cannot be seen, right?
Yeah, that's right. So the palate normally is like a partition between our mouth and the nose. Mouth living in the ground floor and nose in the first floor.
All right.
So it's like the roof of the. So palate is the roof of the mouth. It's the floor of the nose.
Okay.
So when this partition is not fully formed, you can look up into the nose from inside the mouth. In other words, the mouth and the nose are in continuity. They are not separated. It will be like staying in the ground floor with no roof above your head, and you watch everything that's happening on the first floor or have contact with the first floor. So because the mouth and the nose are in contact with each other, all these functional problems come in. Right from the beginning, when the problem of sucking the mother's breast, it needs a negative pressure. Mouth has to be a closed cavity, but here there's a large opening on the roof. So that's why they can't feed. The same thing, so air escapes. Certain words, when we need to pronounce, these are known as the oral consonants. I'll just demonstrate a few of them.
Yes, please.
Like p, sh. These are words where when these syllables are uttered, the mouth becomes a closed cavity, builds up pressure, and then the word is articulated. P. So if this pressure can't be built up because there is a big hole, the air is escaping out of the nose, the p will then come out as k or h, because it's now being modified by the brain, and then the other person cannot understand. For example, if I have to say puppy, I say puppy, and if you keep hearing that all the time, unless you know what the child is saying, you're not going to make any sense out of it. So that's the importance of the palate, separating the mouth from the nose, and also making sure the air pressure builds up, particularly for certain consonants while we articulate.
Right. Now, Mamta, you have said that a major, hurdle in curing children with this condition is ignorance, that parents do not know that there is a treatment, and also that the treatment that you all are giving is free. Now, with very limited health care that is available for children in this condition, how are you all working to make it more accessible to people all over the country? What exactly is it that you all are doing?
Right. So as you rightly said, and I would sum it up again, that the challenges are basically threefold: awareness, as we've already talked about it, affordability and accessibility. So affordability in the sense that many children who are born with clefts, their families just cannot afford the treatment.
Right.
It is a long drawn treatment. It is a comprehensive cleft care from birth to adulthood. So there are interventions which are required at regular intervals. So therefore, the commitment, the financial wherewithal to take care of, each of those processes is just not available. Accessibility also is an issue where, even if the medical infrastructure is there, there is dearth of trained medical professionals in cleft care. People who are specializing, let's say, whether it is speech or orthodontics or even specialized cleft surgery, that is, is a challenge, and therefore, it becomes like a big obstacle in delivering that cleft care. Now, Smile Train comes in and changes the cleft scenario altogether. How? Is definitely by funding, by partnering with local hospitals and doctors and teams, so that each of these challenges, whether it is awareness, whether it's affordability or accessibility, is all addressed. How is, you can say, awareness addressed? Yes, because we take up awareness initiatives. We have a toll-free helpline that's India's first only cleft helpline, which is 1-800-103-8301. So this cleft helpline is for anyone who can call in. Cleft patients who are older, they can call in, their families, their friends, or whoever wants to know what is the treatment, why is it happening, and where do I go for help. Then there are, collaborations with RBSK teams, as I said, state health departments, the border security force, the Shastra Seema Bal. All of these, collaborations with Smile Train, they really help in spreading that message. And then for treatment, for affordability, as I said, that Smile Train is an organization which sponsors, which supports each of those treatments in the entire line of comprehensive care from birth to adulthood. So every block of that treatment is supported financially by Smile Train via its partner hospitals, like the one Dr. Krishnamurthy represents. It's the India's first Cleft Leadership Center in Bangalore at Bhagwan Mahavir Jain Hospital. And how is it different from the others? This is a comprehensive cleft care center, fully supported by Smile Train, which takes care of everything. So
right from the beginning, from
exactly.
the time it is detected, identified, and the procedure starts till the end, till the child has been operated, and post-care treatment. Am I right?
Absolutely. In fact, what Dr. Krishnamurthy spoke about are those tests. The moment it's when the lady is pregnant with a child and it's detected with a cleft, they can come to the Cleft Leadership Center, and there Dr. Krishnamurthy's team will basically counsel. They'll go in for counseling. They'll be educated. They will be kind of briefed on the whole line of treatment and what is required when. The mother will be taught feeding techniques and so on and so forth when the child is born. So that comprehensive cleft care is delivered by the Cleft Leadership Center and everything. So yeah, so this is one model which is working in India, which is the Cleft Leadership Center. And then there are regular partner hospitals, which I said at about 150 in the country, which deliver interventions. So it's a cleft surgery treatment and speech therapy and orthodontics, and that too totally free for everyone. So that is how Smile Train works with local hospitals.
Right, that's great. It's time for a short break. Don't go anywhere. We'll be back soon. Hello and welcome back. We are talking with Dr. Krishnamurthy and Mamta Carroll about cleft lip and palate. Doctor, you have said that if a sonography is done, an ultrasound is done, and it can be detected if the child has a cleft lip. Now, I have done my ultrasound and I have been told that the child has a cleft lip. So I come to you. What is the protocol? Can you take us through that, please?
Right. So this is a long drawn out treatment that sometimes the cleft child has to undergo. But starting off at the time when the parents come in with this ultrasound report, that's a counseling session that we usually have. talk one-to-one with the parents and let them know that this is not the end of the world. You know that this is just a simple birth defect that can be very easily corrected.
Rectified,
and
yep.
the child can lead a normal life. Sometimes you have to understand parents already have an advice from somewhere saying, oh, you're not going to get a normal child. Best way to proceed is to terminate this pregnancy. This is one of the common questions that get asked. We are not judgmental. However, we do explain to them once again that if there are no other serious other anomalies, that it is just the cleft of the lip and palate, this person will lead as good a life as anybody else. However, there will be certain things that need to be done once the child is born. So once they're prepared, they come in as soon as the child is born, or give us a call and we ask them to come over. So the first thing that we need to do is to make sure the mother knows how to feed the child. Once that is done, we carry out a special procedure called as nasoalveolar molding, where we try to rearrange the bones and the cartilages into a better form than it exists, just with the help of an appliance. So this is a non-surgical technique which is carried out right in the second week of life till about 3 months of age, to align the nose, the jaws and the lip in a much better position, so that when we do the operation, we get near normal results. First surgery is usually done between 3 to 6 months of age, that of the correction of the lip. Usually the child will have to thrive and should be about 5 to 6 kgs. The second surgery, that is the repair of the cleft palate, if the cleft palate exists, is done between 9 to 12 months of age. These are the two primary surgeries that are required in the first year of life. Our speech and language pathologists, or commonly called as the speech therapists, take over from here on. They start talking to the parents early on, explaining to them how when the child starts speaking, it can be stimulated so that this child can recover normal speech. Just because the cleft palate has been repaired in time, it is not a guarantor that the speech will be normal. So every 6 months or once in a year, they assess whether the child is developing language skills, whether the speech at that age is appropriate for that particular age of development. And when they find that there are certain things that are not happening normally, they intervene. So they will then do what is called a speech therapy. Most of the times there is a difficulty in pronouncing some words, what they call as misarticulation. And when these misarticulations are present, they work with the child. Around earliest we can start doing therapy for a child is when she is about 2.5 to 3, when she can understand what the therapist is telling her and follow instructions. Before that, it will be only home therapy with parents. So once these misarticulations are picked up, intensive therapy is done, so that by the time this child goes to school, he is speaking normal. The other important thing that there are some more things that needs to follow as the child grows up. We will have a cleft in the gums as well. When we talk about the cleft of the lip and palate, in between these two is the gums where the teeth come in, and there is a gap in the gum or a cleft where a tooth will not come into its natural place.
Right.
So we do not intervene during the time of the milk teeth, but when the second set of teeth are coming in, just before the canine or the third tooth from the center has to come into the mouth, we open up the cleft in the gums and put in some bone there. This is what is called as alveolar bone grafting. This is usually done between the age of 9 to 11 years. Once that is done, the tooth that is higher up comes into the mouth, and then the orthodontist, the one who does the braces, the one who did the nasoalveolar molding at birth, will come in and align the teeth in a nice, beautiful form, which not only improves the appearance but also helps in normal functioning of the teeth. So we have alveolar bone grafting and we have orthodontics. Finally, as the child grows up, sometimes what tends to happen is, because of all these interventions that have been done on the child at a small age, because there was some genetic mishandling of tissues, the upper jaw may not grow normally. It may lag behind, and so when the child is finished growing, we may have to do a final surgical correction of this jaw deformity.
So when you're talking about jaw deformity, what exactly happens?
So
the jaw,
normally, if you look at, yeah, you're right. Normally, if you look at you and me, we have our upper teeth. When we close our mouth, our upper teeth are in front of our lower teeth.
yes.
But in children who have cleft palate, if the jaw doesn't grow fully well,
Okay.
it will be reversed. So the lower jaw will be more forward and
jutting
the upper jaw
out.
is back. Yeah. So then we need to do a rearrangement of the jaw tissues. This is done. This happens even in children without cleft deformities also, but it's commoner in children with cleft. And we wait usually for the growth to be completed, which is between 15 to 18 years of age, and do this final correction. So, so this whole protocol of managing cleft is from cradle to adulthood.
So from the time you do the first surgery, which is, you said, about 9 months approximately, when would, you said adulthood, when again approximately would be the final surgery, doctor?
So girls finish growing a little earlier, that will be about 16 years of age, and boys
Right.
grow till 18. So it's at the age range of 16 to 18 and beyond
All right.
is when the final, not everybody will require this, but some will.
Okay. Mamta, getting to you, you know, that I have read as well somewhere that there isn't enough information, there isn't enough data about cleft and palate problems. Why is that so? And how is it that you all are working towards rectifying this?
Right. So, Mario, the problem is that there is no national birth registry for recording birth anomalies, including clefts in India. This means that many families do not get specialized counseling and care because we don't even know there are how many children are born every year and how many
Right.
children there are as a backlog. So therefore, leading to this, there is obviously a delay, because when you don't know, then how do you plan your interventions, and how do you plan treatment and get to those families and counsel them for the treatment at the right time. And therefore, collaboration between government agencies and NGOs and corporates working in the area of healthcare is so critical, because all the three parties then need to come together. One, to make a plan, how do we build this cleft registry and how do we build awareness so that no one is waiting, everybody gets the cleft care which is provided, but in a timely manner. At least we have the data, at least we should have a database where we know, okay, these are the areas which have cleft children who are being born, and then therefore organizations like ours can prepare for this comprehensive cleft care treatment and can direct our resources accordingly. So yeah, it will really help. Currently we are working with, as I said, with national health missions and agencies like FOGSI, but I think there's a long way to go. There's a lot that needs to be done.
Right. So besides the data that you all are working towards collecting, besides that, what else can be done? Not just, like you said, corporates are required, the government is required to work with this. It cannot be, it is not alone that you all can do it. So as far as the common man is concerned, what is it that you feel that can be done that will help you all and organizations like yours to move forward?
Right. So I think we need to talk about clefts more openly and more often, and who can do this? People who have had clefts and who are now have their own life, and they're leading good lives, and they are in the regular stream of things, and they are, whether they're working in corporates or they have their own businesses and they're very well settled. Those people need to come out and talk about it, and therefore Smile Train is very proud to have introduced something called a cleft, which is Smile Train's endeavor to foster a global community through awareness and education, and therefore reducing stigma to ensuring acceptance of people with clefts. I think these conversations need to happen. And in addition to participating in a variety of sessions and getting into the details of the cleft, navigating through the emotional, medical, and logistical issues relating to clefts is very helpful. Participants have the opportunity to network with, like-minded people, to network with families, to share experience, to share their journeys and learn from each other. I think that is what is important. And we already had one this year in 2022, and we're looking forward to organizing one in February of 2023, so that these communities get together, people become champions, they adopt certain awareness initiatives in their own communities or in their own states or places where they have influence, to influence the others. So therefore, I think this is important, where we all need to talk about this. Even people who don't have clefts, people like the normal lay persons, we need to educate them to basically, so that they are sensitized, so that we can speak about them openly. We have to leave the biases behind. We have to leave things like I am feeling very isolated, those kind of things behind, and come and open up and come and talk about those. Only then will we make a difference.
Absolutely. And this is to our audience, like Mamta and Dr. have been saying, conversations are important. It may not happen to you, it may not happen to your family, but there are children out there who are actually suffering, and the suffering can be brought to an end. We start with open, honest conversations. Doctor, operating on children with this problem, with this defect, I'm sure is not easy. It's not just this child, it is the parents, the grandparents, the entire family actually that get involved. What are some of the challenges that you as a surgeon have to face, besides the family, the child, family, what else?
Yeah, so one of the issues that we faced as we tried to clear this backlog was fear of surgery amongst the parents. It's very real, that's one of the reasons where sometimes they didn't even try to find out, and this can dog you quite often. The other thing is health issues in these children as they grow up. Sometimes they will keep getting infection, for example, in the nose or the chest, and we don't find an opportune time to operate on them. That can be a challenge. The other problem sometimes is levels of motivation, where parents might not have understood that there is a long way to go, so they might drop out of treatment. Remember, this is something that goes on from birth till the child grows up. So oftentimes they slip out of the net and come back to us a number of years later, and we might have missed on some golden opportunities.
Right. So you have said that besides handling the family, the patient, it is also about the fear that the children, the family has, because the children have they're young, they have no say in the matter. So when you're talking about the fear, do you have like a counseling session with people all the time? Or how do you have it? Do you have it individually? Do you have a group that you address to explain to them, to educate them that, this is not as bad as it seems?
Yeah. So we do all the kinds of these things where we may speak one-to-one. Today, we also have a psychologist in part of our team who starts seeing this, and she employs both one-to-one and group sessions as well. But having said all of that, the best method of reducing or alleviating fear. What I see every day outside in my waiting room is when parents waiting for a post-op checkup, talking to the parents who are waiting for a surgery. It's an amazing thing. I see it all the time.
I'm sure.
Going on.
I'm sure, doctor.
We don't interfere. We don't interfere. Half of our referrals today that come in are through a satisfied parent. So they are the best ambassadors. And we also have a group of people who are willing to give their time. And right from the time when a pregnant mother is so shaky, worried, we put them in touch with these older parents who have gone through it all, who have a time to counsel and find that these are our best counselors,
right.
Parents.
Right. That's amazing. And again, very heartening to hear that, someone who has gone through this condition suddenly becomes like a teacher, becomes like a mentor to someone who is having that problem, right? Mamta, earlier you spoke about that you all have this concept, which is teach a man to fish. Can you elaborate on that?
Right. So, teach a man to fish model is basically working, as I said, with local doctors, Indian teams, Indian doctors, Indian medical systems for the treatment of clefts and empowering them. Now, when I say empowering them, empowering is just not funding, right? That's the easiest part. Right. Empowering basically entails training, empowering entails, systems, knowledge transfers, capacity building. That's what the model of Smile Train is, and that's exactly what we do. So whether it is training which happens on various levels, whether it's training in surgery, in various modalities of technical knowledge transfer, which is training in cleft surgeries and the higher nuances of cleft surgery, or training in safety and quality, training the nurses, the OT technicians, the post-op staff. These trainings happen with the sponsorship of Smile Train all the time. So we have specific training modules, we have training sessions for all the medical fraternity and facilities. We also have participation in conferences. So whether we are organizing in-country conferences, we have conferences with the Association of Plastic Surgeries, the Association of Maxillofacial Surgeons, or we have associations of anesthetists for safety trainings. We also collaborate with international organizations and give the opportunity to our teams to travel there, to go and network with them, to see what is happening in the cleft world, to get a hang of the latest,
and yes,
not
to
just
get
the
knowledge,
techniques, but the latest information. There's a knowledge, there's an information exchange which happens from their country to ours and vice versa. So we do have these programs at various levels where we do capacity building. We also are supporting infrastructure. So supposing we are working in some remote location or a hospital facility which lacks, let's say, the anesthesia machines or OT lights, some equipment, Smile Train supports all of that. So we give them funding to buy those latest equipment so that they can enhance their own safety standards and safety standards of the hospital. So support happens at different levels. So it's training, it's equipment, it's capacity building. It's a complete package that we offer.
Of course, and there is a lot of work. So your team basically consists of, first and foremost, is the surgeon who does a major amount of work. Then you have counselors. Then you have dentists, orthodontists, and you just spoke about anesthetists, and doctor, who else comprises the team?
The speech and language pathologists,
oh yes,
the speech therapists, and the nutritional counselors. Then the psychosocial workers, the social workers who go out into the community and try and look for patients, motivate the parents to bring them to the hospital. So there is a whole network of people. In addition to that, oftentimes we have to consult a cardiologist or a geneticist, find out certain special problems that may be there with these children.
If you were to share one story with us very quickly, one success story that is very close to your heart, Doctor, which story would that be?
Yeah, very quickly, it's a mother who stays in where you are from Goa now. She used to be in Bangalore, and I've now treated her child. She's 11 years old, and I got the other day some beautiful pictures of the girl post her bone graft surgery, and she says to me, "I thank you every day for giving my daughter a beautiful life, doctor. God bless you and your family." Even for an atheist like me, it's a blessing.
I feel happy about listening to you say that, because I can imagine the emotion, the gratefulness that the parent, and as a child grows older, I suppose the child feels it themselves. So it is gratefulness to what you have done for the child. Now, Mamta, my last question to you, this is all the time that we have, is besides the platform that you have been speaking about, and is there any other way that we can increase awareness and sensitivity? Because I think that awareness and sensitivity is very pivotal in reaching out to many more children who are suffering with this, and not just children, but even their family.
Yeah, thank you, Maria. Absolutely. I mean, channels such as yours, the program, I think it's so important because you talk about these issues, you engage with discussions. I think this is what is required, that we really need to come on a platform like this, which is talk from the heart, and talk about these topics in a very sensitive manner, in a manner which is understood by everyone, and has a buy-in with everyone. I think there is a need for collaboration. There's a need for more sensitivities amongst not just you and I, not just people who are involved in this cause and working with this cause. I think general public, and I think lay public, because when you see cleft is something you can see, it is apparent, it's in your face, it's something which is directly related to self-esteem and what you think about yourself. Right? So when you look in the mirror the first thing in the morning and you look at yourself, that is something that you need to feel good about it, right? But unfortunately with clefts it doesn't happen. It feels like a curse. It feels like, why did God have to do something like this to me? And therefore we as people who are working towards this cause, and the more we collaborate, the better it is for us to be sensitive to whatever the person wears, or whatever the way the person looks, is to accept them the way they are. And also, our teams to work towards making everyone is beautiful. I think that's the message that we need to kind of take forward. And thank you. And I think the media plays a very important role in helping us, helping organizations like us spread the message. I think Talk from the Heart and you and your channel, I think, is doing amazing work in taking.
Thank you very much.
Thank you very much.
Thank you. Thank you. Doctor, my last question to you is, what would be your advice to parents who have a child with this condition?
Do not despair. Your child is going to be as normal as anyone else's. Take heart.
Thank you so much. Thank you. Mamta and Doctor, it has been absolutely informative, and I'm sure to those of our viewers who are listening, you have learned so much from this talk. Like Mamta said, there is, and like Doctor said, of course, there is no need to despair. It is not the end of the world. Today, technology and organizations like Smile Train are there to hold a hand and hold the child's hand and the family's hand and take them towards a better future where there is no discrimination. We all need to be involved. We need to be aware. We need to be involved. And we have to help those who are in a situation like children with this condition. So let's all move forward. Let's do our bit. And from all of us here, Thank you for watching. Thank you for listening, your time, your patience. And from all of us, bye until next time.